Part of what we do is identifying what good looks like and then help share that with others.
They're physically located here in the building with the rest of the departments, so there's very close integration.
Capita's primary responsibility within that is to manage the first line service desk team that support over 22,000 healthcare professionals across all main hospital sites and community buildings within Belfast.
It's been a very successful service. Its core hours are 8 a.m. to 6 p.m. with a 24/7 element beyond that.
During the core hours, the team would deal with over 100,000 service requests and faults logged either via portal or on the phone. Outside of core hours, Capita provides an out-of-hours service which acts as a liaison between the person calling in the issue and the Belfast Trust engineer themselves.
We have provided a single sign-on service for 3 health trusts, and today that is used by 30,000 trust-based staff.
They fix what they can immediately in a professional and effective manner, and that which they can't fix, they'll escalate to the right people with the right impact and urgency attached to that issue. The benefits of the on-site service desk to the customer are that we have instant communication feedback between ourselves and the customer and the end user. The fact that we're using the same tools as the customer and the same hardware means that we're speaking the same language, and it allows us to instantly identify trends to highlight to the customer for quicker reaction times. Capita will take on training and resource management, and it allows the trust to take a more holistic view of their tasks and hopefully improve the overall service.
So the health sector is very important to Capita. We've had a long pedigree of working in health, so more than 20 years of providing services to health and social care organisations across Northern Ireland.
Their professionalism and their friendliness is always commented upon by our user base. I don't even know if our user base are aware that it is a managed service and it's a staff member from Capita who answers the phone and log the call, because it's perceived to be the Belfast Trust.
The service has worked very well for the Trust. They've had enormous benefit from it, both financially and in the consistency of the service provided back to their users.
We regularly run customer satisfaction surveys, and it's always highlighted the over 95% satisfaction with the professionalism and the demeanour and the friendliness of the first line staff. So they provide a very good service for the Trust.
So in the future, I think the core services that we see ourselves bringing forward from our own portfolio are digital services to help the health service to automate and drive efficiencies, because health is really at a critical juncture where it needs to do more with less. It has less resourcing and less funding.
Plans for the Trust moving forward this calendar year are primarily cyber security, ensuring that the Trust can still provide the service for our end users.
We recently implemented a similar service desk in the South Eastern Health and Social Care Trust successfully, and we were hoping to branch into other trusts and replicate that level of service there.
Some of the other services that we see that we can bring to market are BI services, so leveraging the wealth of data that health trusts collect about patients and really using that in a different way, to analysing that data to help them provide early insights to what's coming down the line for them as well.
It's a local presence, and as such they're very responsive to the Trust with regard to how we work together. They are proactive.
And while we're carrying Capita's vision statement, we're also able to translate that to the customer's mission statement and integrate that where we can.
So the relationship has been beneficial to both parties because of the willingness on their part to meet us halfway. So I have no issue, and always Capita would be my first port of call if I was looking something done.